A brand new national cabinet, completely aligned on one key issue.
Carl Sandilands is someone who's a significant figure.
Not that key issue. Anthony Albanese promising a $2.2 billion Medicare overhaul in next month's budget to fund a host of
practical measures.
Those practical measures include more nurses, an expanded scope of practice for health workers, incentives for GPs to keep their doors open longer, and
we'll introduce My Medicare Patient ID to support wraparound care for patients.
Designed to improve continuity of care with follow-up for patients presenting to emergency departments. There's also plans to fast-track migrant healthcare practitioners into our understaffed system.
Some of the bureaucracy is taking too long to make sure that people with qualifications can actually participate and provide healthcare in this country.
It couldn't come at a better time. The AMA's public hospital report card today showing performance is at its lowest ever level.
The 8th AMA president to stand here and say things are getting worse.
Just 58% of emergency room patients needing urgent care were seen within the recommended 30 minutes. Almost 1 million people waited longer than 9 hours. The AMA president cautiously optimistic today's announcements will help.
We need to make health accessible and affordable for Australians, particularly the most vulnerable Australians.
So will these
practical measures
be the practical magic needed to resuscitate Australia's healthcare system?
The problem with practical measures is that you really do have to see them in practice sooner rather than later. There's already questions over whether or not the $2.2 billion to overhaul Medicare is going to be enough, if it's going to be actioned quickly enough. And right now, as you can see from that story, we're desperate. We need nurses, we need more doctors.
I think it's obvious, right, that none of those individual measures is going to solve this problem on its own. I suppose the open question is, if you do make all of those tweaks around the system, whether that's enough to kind of push out and just create enough room for the system to work a little bit better than what it is at the moment.
Yeah, but 1 million people go in emergency rooms and waiting for over 9 hours. That's really scary. I was recently at the hospital with someone who had chest pains, and they were there waiting for 12, 13 hours before they got properly seen. Eventually, they ended up just going home and leaving because they weren't getting the help they required, And it's really, really scary for people. And who knows if that, money, as you said, will be enough.